Hi everyone, Dr. Samina here, naturopathic doctor, and today I'm talking about things to consider when you first get a diagnosis of PCOS. It can feel very daunting and honestly feeling like you're alone when you get a diagnosis of PCOS because oftentimes not a lot of information is given out on that first diagnosis. But I'm here to give you some information on what you can do right away at home to really help to manage your symptoms of PCOS and really consider top three things that I think would be really important when it comes to a diagnosis of PCOS. So, first things first, just to know, PCOS can be very much managed in most cases through diet and lifestyle adjustments. And obviously, the first thing we really want to consider is diet. Diet is a huge component to managing blood sugar, hormones, basically everything in our body. If you think about what the diet is, anything you put into your body is a direct reflection of what you're going to see in terms of symptoms and how you feel overall. So, when it comes to diet, the most important thing is to really make sure that you have a diet that's very clean and free of processed foods like sugar, for example. There's been many diets that have been studied for PCOS: ketogenic diet, low carbohydrate diet, and even the DASH diet, which is commonly used for reducing the risk of heart disease. They actually did a study with women who were obese, and they followed the DASH diet way of eating for over 8 weeks, and they actually found a reduction in insulin resistance, which is a common underlying cause of why we see weight gain in PCOS. They also saw a reduction in belly fat. So the DASH diet mainly focuses on fish, chicken, vegetables, whole grains, and low fat dairy products. It really just encourages the person to eat foods that are not processed, not full of sugar, and not full of high saturated fats. When I think about PCOS and dietary changes, one of the biggest things we want to consider is balancing blood sugar. And the way we do that is eating high fat, high protein, lots and lots of vegetables, and a little bit of carbohydrates. When I'm talking about fats, we want to be eating good, healthy fats like avocados, good, healthy nuts and seeds, and good, healthy oils. We want to stay away from oils like vegetable oils and canola oils and really bring in all the good omega 3 fatty acid oils like avocado oil, olive oil, flax oil, and grapeseed oil. So that's something to consider. Diet is a huge, huge component, and if you're struggling with figuring out what to do in terms of diet, definitely reach out to a naturopathic doctor like myself who can help guide you on figuring out a plan that's very specific for you. Next is exercise. The most important thing I would say is making sure you get your body moving when it comes to PCOS. It actually really improves insulin resistance, and research actually shows vigorous aerobic exercise and resistance training can really help to improve insulin sensitivity, which, when we improve insulin sensitivity, glucose gets into the cells and our weight gets much better and we start to actually lose weight. And also, when insulin is high in insulin resistance, that increases testosterone, and that's where we see symptoms of high testosterone like acne, hair loss, and excessive hair growth. So, we really want to bring insulin down, and the way we do that is by moving our body. So vigorous exercise, HIIT training, but sometimes these can be a little bit too intense for a lot of women in terms of the intensity. If you're feeling like this is way too intense after the workout, you're feeling really tired, maybe what needs to happen is the intensity needs to decrease. What's really also interesting is this exercise can actually mitigate cardiovascular risk disease in women with PCOS. And another form of exercise that's, lower on the intensity scale, but has been shown to really help women with PCOS is yoga. So, regular mindful yoga each week actually improved androgen levels. So, this is testosterone. So, overall, just make sure you keep your body moving and you're, making sure that you're actually using your body for movement and exercise, because this can really help manage a lot of the symptoms of PCOS, especially irregular cycles, weight gain, and also the symptoms of high testosterone. Okay, last but not least is supplementation. And I really feel like supplements can really help to kickstart the body's natural ability to carry out some of these functions, like making sure we balance blood sugar and insulin, bringing testosterone down, reducing inflammation, and overall increasing energy as well. There's so many supplements out there, but I'm just going to list off a few. Always make sure if you're going to take any supplements or change anything in your lifestyle to talk to a healthcare professional like a naturopathic doctor, especially when it comes to supplements. We're really well trained in this area. So things like myoinositol, zinc, chromium, N-acetylcysteine, spearmint, even omega-3 fish oils, magnesium, the list goes on, but definitely make sure to get a healthcare professional that is really well versed in PCOS that can help build a plan for you. I also want to mention one of the biggest things when it comes to PCOS is sleep and stress management. This is really important when it comes to making sure you can actually eat well for yourself and exercise and take the supplements you need. So if sleep and stress are not really focused in on at the very beginning, it can be hard to kind of make these lifestyle changes. So definitely, if you have any questions at all, drop them in the comments below and I'll make sure to answer them. Have a good day, everyone.